In today's video, we'll be discussing things you should never do while taking apple cider vinegar. We'll cover the risks of mixing ACV with medications, the dangers of consuming it undiluted, the importance of not overdoing it, why you shouldn't take it on an empty stomach, and why relying on it as a weight loss shortcut is a bad idea. So, stick around, and let's dive right in. Apple cider vinegar, ACV, can interact with certain medications, leading to adverse effects or reduced efficacy. Some common medications that may interact with ACV include: ACV may enhance the effects of diuretics, causing low potassium levels, hypokalemia, and potentially leading to muscle cramps, weakness, or irregular heartbeats. ACV can affect blood sugar levels, and when combined with insulin or other diabetes medications, it may result in excessively low blood sugar levels, hypoglycemia. This can cause dizziness, confusion, and even loss of consciousness. ACV has a mild laxative effect, and when taken alongside other laxatives, it can lead to diarrhea, dehydration, and electrolyte imbalances. ACV may have blood-thinning properties, which can increase the risk of bleeding when taken with anticoagulants like warfarin. Some heart medications, such as digoxin, can interact with ACV, leading to low potassium levels and increasing the risk of side effects. Before incorporating ACV into your routine, it is essential to consult your healthcare professional, especially if you are on medication. Your doctor will be able to advise you on whether ACV is safe to use alongside your existing medications and may suggest adjustments to your dosage or provide alternative recommendations. Never stop or change your medication without first consulting your healthcare provider. Consuming undiluted apple cider vinegar can lead to several health issues due to its high acidity. Here are some potential problems that can arise from ingesting undiluted ACV. The acetic acid in ACV can cause a burning sensation in your throat and potentially damage the esophagus lining if consumed undiluted. This can result in pain, difficulty swallowing, and long-term irritation. The acidic nature of undiluted ACV can erode tooth enamel, making your teeth more susceptible to decay, sensitivity, and discoloration. This can lead to dental problems and compromise your oral health. Consuming undiluted ACV can irritate the stomach lining, resulting in symptoms such as pain, bloating, indigestion, or heartburn. In severe cases, it may even cause gastric ulcers. The acetic acid in undiluted ACV can cause chemical burns if it comes into direct contact with the skin, eyes, or other sensitive tissues. To avoid these potential issues, always dilute ACV before consumption or use. A common dilution ratio is 1 to 2 tablespoons of ACV mixed with 8 ounces, 240 milliliters, of water, juice, or another liquid. You can also incorporate ACV into your diet by using it as a salad dressing or a marinade for meats and vegetables. Diluting ACV not only helps protect your body from harm but also makes it more palatable, allowing you to enjoy its potential health benefits safely. Overconsumption of apple cider vinegar, ACV, can lead to various health issues, as excessive amounts of acetic acid can cause imbalances and harm your body. Here are some potential problems associated with ingesting excessive amounts of ACV. Consuming large quantities of ACV can result in decreased potassium levels in your body. Potassium is an essential mineral that helps regulate muscle contractions, nerve function, and fluid balance. Hypokalemia can lead to muscle weakness, cramps, irregular heartbeats, and, in severe cases, paralysis. Long-term excessive consumption of ACV can lead to reduced bone density, increasing the risk of osteoporosis and fractures. The acidity of ACV can leach minerals such as calcium from bones, weakening them over time. Ingesting too much ACV can irritate the gastrointestinal tract, leading to symptoms like diarrhea, nausea, and acid reflux. In some cases, excessive ACV consumption can even cause or exacerbate gastric ulcers. As mentioned earlier, ACV can interact with certain medications, and consuming large amounts can amplify these interactions, potentially leading to severe side effects or reduced drug efficacy. To minimize these risks, it is essential to stick to the recommended dosage of ACV. Generally, 1 to 2 tablespoons of ACV diluted in a glass of water or another liquid per day is considered safe for most people. However, it's crucial to consult your healthcare professional before incorporating ACV into your routine, especially if you have pre-existing medical conditions or are on medications. They can help you determine the right dosage for your individual needs and ensure that ACV is safe for you to consume. Consuming apple cider vinegar, ACV, on an empty stomach can cause a range of unpleasant symptoms due to its high acidity. Here's a closer look at some issues that may arise from ingesting ACV without any food. Drinking ACV on an empty stomach can cause feelings of nausea and general discomfort. This is because the acetic acid in ACV may irritate the stomach lining, especially when there is no food present to buffer its effects. Consuming ACV without food can lead to indigestion as the acetic acid stimulates the production of stomach acid. When taken on an empty stomach, this increased acid production may cause discomfort, bloating, and gas. The acidic nature of ACV can exacerbate heartburn or acid reflux symptoms, particularly when consumed on an empty stomach. This is because ACV can relax the lower esophageal sphincter, which normally prevents stomach acid from flowing back into the esophagus. As a result, the stomach acid can more easily enter the esophagus, causing irritation and discomfort. To minimize these potential issues, it's best to take ACV with a meal or after eating. Consuming it with food helps to buffer the acidity of ACV, reducing the likelihood of irritation and other side effects. Additionally, taking ACV with a meal can help improve digestion and nutrient absorption, allowing you to enjoy its potential health benefits without the discomfort. If you still experience side effects when taking ACV with food, consider reducing the amount of ACV you consume or diluting it further with water or another liquid. Alternatively, you can try taking ACV in the form of capsules or gummies, which may be gentler on the stomach. However, it's essential to consult your healthcare professional before incorporating ACV into your routine, especially if you have pre-existing medical conditions or are on medications. While apple cider vinegar, ACV, has been linked to modest weight loss in some studies, it should not be relied upon as a quick fix or sole solution for shedding pounds. Here's why using ACV as a weight loss shortcut may not be effective. The research on ACV's impact on weight loss is limited, with most studies being small-scale, short-term, or conducted on animals. While some findings suggest that ACV may help reduce appetite, increase feelings of fullness, and boost metabolism, these effects are generally mild and may not lead to significant weight loss on their own. Relying solely on ACV for weight loss can result in an unhealthy and unbalanced approach to nutrition. This may lead to weight fluctuations or the regain of any lost weight once you stop using ACV, as the underlying issues contributing to weight gain have not been addressed. As mentioned earlier, excessive consumption of ACV can lead to a variety of health issues, including low potassium levels, bone loss, and digestive problems. Using it as a weight loss shortcut may encourage overconsumption, increasing the risk of these side effects. Instead of using ACV as a weight loss shortcut, it's essential to adopt a healthy, balanced, and sustainable approach to weight management. This should include a nutritious diet. Focus on consuming a variety of whole, minimally processed foods, such as fruits, vegetables, lean proteins, whole grains, and healthy fats. This will provide your body with the nutrients it needs to function optimally and support weight loss. Regular physical activity. Engage in regular exercise, including both aerobic and strength training activities, to burn calories, build muscle, and improve overall health. Proper hydration. Drink plenty of water to support digestion, metabolism, and overall well-being. Adequate sleep. Aim for 7 to 9 hours of quality sleep each night, as inadequate sleep can contribute to weight gain and poor overall health. Stress management. Practice stress reduction techniques, such as mindfulness, meditation, or yoga, to help manage stress, which can contribute to weight gain and make it more difficult to lose weight. Incorporating ACV into a balanced diet and healthy lifestyle may provide some additional benefits, but it should not be considered a standalone solution for weight loss. Always consult with your healthcare professional before making significant changes to your diet or exercise routine.